The United States has now passed a sobering and deeply troubling milestone: more than 700 confirmed measles cases in just the first few months of 2025. What should alarm public health officials, policymakers, and ordinary citizens alike is not only the rapid surge in cases, but the circumstances under which this entirely preventable disease has been allowed to resurge in a modern, highly developed nation. This is not a failure of medical technology or scientific knowledge. It is a failure of society, communication, and public trust in the systems meant to protect us. The data released by the Centers for Disease Control and Prevention are stark. Over 30% of these cases have occurred in children under the age of 5, children who are especially vulnerable and often too young to have completed their full vaccination series. Of those hospitalized, the majority have also been under 5. Another 38% are among children and teens between the ages of 5 and 19. These numbers alone should set off alarms. We are witnessing a significant portion of an entire generation exposed to a disease that was once nearly eliminated in the United States. Even more disturbing is the fact that nearly every single case, 97%, has occurred in individuals who are either unvaccinated or whose vaccination status is unknown. That's not a coincidence. That's an indictment of our fractured approach to public health and the growing resistance to vaccines. It's the result of misinformation, politicized science, and an erosion of institutional trust that has taken hold in many parts of the country. Nowhere is this crisis more visible than in Texas, which accounts for the majority of the national caseload, with more than 540 confirmed infections. In Gaines County alone, cases have soared to 355. But the numbers tell only part of the story. Behind the statistics are real human lives. 2 unvaccinated children, healthy before infection, have died from complications related to the measles virus, including an 8-year-old girl. These deaths are not unfortunate accidents. They are the predictable and preventable outcomes of a society that has grown complacent toward infectious diseases. This resurgence is not just a localized issue. With cases confirmed in over 24 states, the disease is becoming increasingly difficult to contain. The highly contagious nature of measles, capable of lingering in the air for hours, means that even a single case can lead to dozens more if basic public health protocols are ignored. That's what makes this situation particularly dangerous. We are not only failing to protect the unvaccinated, we are threatening the integrity of herd immunity for the entire population. And it's only April. With more than 8 months still remaining in the year, the current numbers have already eclipsed the total number of cases in all of 2024, which stood at 285. If this trend continues, 2025 may see one of the worst measles outbreaks in the U.S. in recent history, reversing decades of progress made through rigorous immunization campaigns. This is not merely a statistical setback, it is a public health disaster in the making. What's equally frustrating is that the solution is both obvious and accessible. The MMR, measles, mumps, and rubella vaccine is highly effective and widely available. It has a long-standing record of safety and success. The booster schedule is well understood and easy to follow. There is no technological barrier here. The obstacle is social, cultural resistance, distrust in science, anti-vaccine activism, and policy gaps that fail to enforce or encourage immunization in key populations. This moment demands urgent intervention. Public health agencies must do more than issue alerts. They need robust funding and political support to conduct targeted outreach in affected communities. Schools and local governments must reevaluate immunization requirements. Healthcare providers should be empowered and expected to educate and advocate for vaccines with a stronger, unapologetic tone. And society at large must reckon with the consequences of letting misinformation fester. We cannot afford to pretend that vaccine hesitancy is a harmless personal choice when it so clearly endangers public safety. What begins with one unvaccinated child can, and does, end with the hospitalization or death of another who never had a choice. This outbreak is not just a health crisis. It is a mirror held up to our national values, exposing cracks in our collective ability to act rationally, compassionately, and responsibly. The deaths of children from a preventable disease should never be acceptable collateral in a war over personal freedom or ideological pride. We are not just facing a resurgence of measles. We are staring down the consequences of our own societal failures. If we do not act now, boldly, honestly, and collectively, the toll in lives, trust, and progress will only grow. And the worst part? We'll have no one to blame but ourselves.